First, I want to deal with the virus itself. There's been quite a lot of discussion about the nature of the virus, where it came from, how virulent it is and how it spread. We now know something about it. There's been a lot of pathogens over the last few years which have been transmitted through wild animals into other animals and then into human beings. These pathogens have spread into human beings for which we have no immunity, although the wild animals do, because of the massive spread of human urbanization, logging, fossil fuel exploration, generally the huge global expansion of capitalism's drive to industrialize, urbanize, and use up nature's resources. That's brought us very close to nature and to wild animals who've been holding these pathogens for a long time. In this particular case, it seems to have come probably through bats into another animal, farm animal or wildlife animals held in markets in China, and then from there through human transmission to the rest of the world. And the question we have to ask ourselves, is this a really dangerous pathogen, a dangerous virus? I mean, there's a lot of discussion going around on the social media, amongst the left as well as the right, that actually it's no worse than flu, and really this is a fuss about nothing. Well, first thing you have to say is that it is much more dangerous than flu. First of all, its transmission rate, which is the top thing in that graph, the RO number is much, much higher than it is with flu. If there's no containment, the incubation time is a lot longer, which means you don't notice you've got it, or it builds up in a number of human beings and makes them ill before you can do anything about it. Symptoms take place much later. The hospitalization rate is much higher because when it affects people, particularly as we now know, old people and generally sick people, you get a massive increase in hospitalization, which is the big issue for the lockdowns. And then the issue which is continually debated is the fatality rate, not the case fatality rate, but the fatality rate likely in the whole population. As far as the latest data shows, it looks as though it's somewhere between 0.6 and 1% of the world's population could die from this if there was no attempt to control the transmission. That's 6 to 10 times more deadly than annual flu. So contrary to the view that it's no worse than flu, so far the evidence shows that that's absolutely wrong. It is way, way worse, both in its spread and in its deadly feature. Indeed, here's a little graph which shows, if you can follow this, that if there was no containment whatsoever of the virus, no control over transmission whatsoever, then if you had a 70% of the population infected with a 1% mortality rate, that would mean 50 million deaths globally if there was no attempt to control the virus and you just let it spread towards what is called herd immunity, where the point where the virus wanes because enough people have been infected. And if you look at the blue blocks there, that's the normal mortality rate in different countries each year, the rate per thousand of population. If you add in this COVID-19 with no containment, then you add in all that dotted white block as well. So you're nearly doubling the mortality rate that we normally get. And the little red bits is how able countries are to control or otherwise this COVID over the last couple of months. You can see that countries like Spain, France and Italy have actually not been able to control it that well, and there's been quite an increase towards excess deaths in those countries. And of course we have later figures which show that. While on the other hand, South Korea, China really have avoided any excess deaths on the whole by the methods of mainly, as we'll hope to discuss, being prepared. They have had good hospital systems on the whole. In the case of South Korea, Taiwan, and a few other countries, they've had plenty of hospital units, plenty of intensive care units. They've had testing, contact and trace. By doing that, they've been able to reduce the transmission, and also those people who have to be hospitalized have generally got the facilities and hospital equipment to handle, particularly as they're mostly old and frail and sick, as we've now found out. Our own health minister in the UK claimed that we were well prepared on the 23rd of January. Anybody who sees the data and have followed the information about how well prepared the health system was under the Conservatives realizes that's rubbish. That we haven't got the testing, we haven't got the contact and trace, we didn't have enough hospital beds to begin with or ICU units. protective equipment not available to hospital workers, those on the front line. All this was a total failure, and also a very slow process towards going to a lockdown in order to control the transmission of the virus. So that's why the UK has a very high rate of deaths and number per million of population, but also in absolute numbers. And because most hospitals and health systems around the world and governments in control of them were not prepared, they ignored the risks of pandemics, which many international scientific organizations were referring to. They had cut health services to the ribbon so that there was no extra capacity to cope with this new virus. Then the only possibility of controlling the virus was to try and what they call flatten the curve so that health systems weren't overloaded. That means if you did nothing on this graph, that big dark line at the top would tell you the number of people that would get critically ill and die. If you did some isolation and then some quarantining and then closing the schools, then going to a full lockdown, you can drive the curve down. And that is what most governments have been forced to do, rather than having a policy of testing and control in that method and social isolation. They've had to go for the most dramatic and deep lockdowns in order to try and control this virus. And I say again, this virus is dangerous. Don't think that it's like flu, that if you did nothing, it would just pass away like flu does every year, kill a few 100,000 old people. This is way, way worse if it had not been attempted to control. Just look at the positions in London alone. It's a bit out of date, but you can see the huge excess deaths that have taken place in London compared to previous years going forward. And so you can see that if this virus had been allowed to rocket through the UK and elsewhere, then you've had months and months, days and days of excess deaths. At the moment, this is beginning to come down on the graph, but it will still, at the end of the year, show a significant increase in the number of deaths in 2020 compared to previous years. And I have heard the argument, I hear it now, read it on social media. Look, you see, we didn't need this huge lockdown that's destroying the economy. We could have just had a bit of isolation. We could have closed down mass events. We could have closed the schools and universities like Sweden has done, a light lockdown. And the argument here is that Sweden's succeeding in doing this, and rather than having these heavy lockdowns which are destroying the economy. Well, all I can say is look at this very latest graph of yesterday. Where is Sweden on the list of increases of deaths per million of people? It's way up near the top in Europe. There's no way that you can say Sweden is being more successful than anybody else with its so-called light lockdown. And if you look very closely at the graph, you can see that Sweden is still not peaked. It's still moving up, while other countries are beginning to turn downwards through the lockdown. We shall see. But the argument amongst a lot of social media people that Sweden is the way to go and we didn't have the lockdown, it was a plot by capitalism to have a lockdown, it seems to me not based on the science, and that's perhaps something we can discuss in this meeting. The lockdown has now, across the world, stopped 2.7 billion workers worldwide affected by a lockdown. 81% of the world's workers are now in areas where there are lockdowns. The world economy has never seen anything like this. We're talking about a collapse in global output of something like 5% according to the IMF, OECD, and so on. This is way worse than the Great Recession. Most economies, while they're in the lockdown, are seeing a reduction in output and in income and employment by 25, 30%, directly affecting most sectors, up to a third of all the sectors in the emerging economies. So leading economists say that this collapse, maybe short term, a couple of quarters, maybe not, is going to exceed anything we've seen in the last 150 years in terms of world capitalism. This is a major event for the capitalist economy. And the IMF chief says 170 countries are now will experience a negative per income decline in this year. And what it demonstrates to anybody who thinks about it is that if workers don't go to work, nothing gets produced. I mean, this may sound like a simple statement, but you'd be amazed at how many people think that workers don't count in this world. What matters are the people at the top, the chief executives, the politicians, the finance executives, the hedge fund managers, the marketing executives, the real estate executives. I was just thinking the other day, if the hedge fund managers, the financial people, the marketing executives, the advertising executives, all those elements, business service executives, if they all stop work, would we notice? We would not notice. But if the rest of us stop work, people who actually produce value, as Marx says, then we notice very quickly in just a few weeks, not even a year. And that's one of the key lessons you can learn from this lockdown. And the lockdown is heavy. Here is a figure from the IMF, which reckons that the cumulative output loss between the bottom of this slump, which we're heading into in the summer of this year, and perhaps the recovery after that, will be at least $9 trillion or 10% of global GDP. Lost forever. That red bit there is lost forever. It's not coming back. It's you dig a hole in the ground, but you can't fill it up in the economy. It's gone forever. And that losses of employment, resources, and people's livelihoods in that red block. Even for the first time, we can now say that this year, the so-called emerging markets, which include in this graph India and China, will see a slump for the first time since records began for emerging economies. There are loads of emerging economies that aren't emerging at all. They're extremely poor. But China and India are the great examples of emerging economies going forward. And usually they keep that growth rate, as we can see in the blue line, in the plus column. If you take out China and India, then emerging market growth is very weak. But including them now in 2020, there will be a slump for the first time. Billions are losing incomes. According to the International Labour Organization, over 2 billion people, mostly in informal economy, short-term contracts and so on, are going to suffer a huge loss in their wages during the months of these lockdowns and the crisis. More than 500 million people are going to go back into poverty using the poverty measure at the Oxfam level of $5.50 a day, which is a high one compared to the World Bank. But we're going to see a huge loss of people making that level now and heading back into poverty as a result of this collapse. And if we come into countries like the UK, this is the UK, only half of workers now are actually at work, or they're being furloughed, or their employers have temporarily or permanently closed. The businesses are temporarily closed. Turnover has been reduced in others. And really a high percentage of businesses, over 65%, are either closed or not making sufficient money to make themselves function. And most households in the UK now have lost huge amounts of money, even in this short time, reduced income, 70% claiming they've lost income. And if you go down the list, we know that there are even people who cannot afford to pay even basic bills at the moment. And so this huge GDP decline, which is going to hit the major economies of the world, like the US, continues for some time ahead. Now, I want to ask, what's going to happen now? Is this all going to be over by the end of this year, as many people in the stock market, American leadership and Britain claim it will snap back by the end of the year once the lockdowns are over? Well, I would say that's very unlikely. For what first reason is that capitalism was already teetering on a recession before the pandemic hit. Growth had already been reduced to very low levels. Europe was in recession. Japan was in recession. The US was slowing down fast. The UK was in recession before this virus hit. And the main reason, in my view, was a significant slowdown in profitability for capital across the board. This graph shows the situation for the G7 on profitability, and you can see that we're at a period of generally depressed profit rates for some time, despite short booms. The Great Recession has taken that down, and now the capitalism is not really seeing a revival in profitability, and profitability is key to capital investment and of overall faster growth and employment for everybody. So in my view, capitalism was already on the edge. This COVID epidemic has driven it over the edge and down the cliff much quicker than perhaps we could expect, and certainly much deeper. There will be no return to normal. Here's an indication of the trend we've seen since the Great Recession in growth in the US, the dark blue line growing at that sort of rate. Then we got to the Great Recession in 2008-9, and the trend recovery has been very weak. So that showed before we even got to COVID, the US economy was growing at a much lower trend growth rate than we've seen before. And the estimate now from Resolution Foundation, amongst others, is that we can see that with this COVID collapse and given the experience of past recessions, we're likely to see a 14% drop, at least, in UK GDP during the slump that's now underway. And more than that, we will never, ever return, the UK economy will never, ever return to the pre-crisis trend that it had before the Great Recession and since. This is a disaster that cannot be reversed. That's an indication of how serious it is, how feeble and failing the capitalist economies of the major economies of the world. So I'll finish on this chair. There are some lessons. These are some lessons that we want to think about. First, this didn't come out of the sky. It wasn't an asteroid out of the sky. It wasn't some sort of thunderbolt or shock that we could not have known about. Capitalism has been generating these sorts of crises for some time, with environmental pollution, industrial farming, climate change, and the way in which it has allowed, through these measures, these pathogens to enter the human body. There are more pandemics to come, and maybe a second wave on this particular one before we can control it. So the first thing to be clear is that the virus did not cause this slump. The way in which we organize our society internationally caused this slump, leading to the virus, as it were, striking back. And also we learned that the market doesn't work. By privatizing health services, decimating health systems, cutting back public services to the minimum, not being having the sort of organized, planned intervention that health systems need to deal with such crises, where there's been, on the whole, total chaos in many governments and a failure to act. But in the end, private health systems have had to give up and hand over to governments to try and intervene and direct. The market is not working. And also, this crisis has exposed whose workers are the most important and whose aren't. Who would we rely on in this system rather than the people I mentioned before? We're told that the world's billionaires are very important people, but the result is, of course, that they play no role whatsoever in helping this crisis. It's ordinary people on 1/1,000,000th of what Jeff Bezos is earning every day, who are holding up and making this, dealing with the health crisis and also helping to keep the whole system going at some level. The failure of private health and big pharma, by the way, 15 out of 18 US pharmaceutical companies spend no money whatsoever researching on vaccines or anything to do with viruses. They spend most of their time looking for tranquilizers, methods to deal with people's depressions and so on, rather than these issues. So we have pharma has failed, private healthcare has failed. We need a public healthcare system which invests in research and production of medicines and vaccines throughout the world, free at the point of use. What bigger lesson can the labour movement push into the minds of people across this country and the world, but the need for free public healthcare and a proper healthcare system properly funded? Instead of bailing out big businesses, is what the US and the UK government are doing, we need to take over those sectors of big business that have failed and bring them into a planning system, because otherwise we are not going to return to normal. It's not going to be possible to revive the economy in an effective way and restore people's jobs at previous levels. And in the poor countries, one of the major demands must be to cancel the debt of the poor countries. They're now piling up more debt, and they can't possibly fund that. The IMF and the World Bank are offering dribbles of money to help them, and in no way can that help. We need to demand the cancellation of the debt for these countries, and also to end the huge tax haven shifting of profits which the big corporations do at the moment, the likes of Amazon, Microsoft and all the rest, whose mostly their profits end up in tax havens rather than in the hands of governments to use for revenues. I just thought the other day, we had Amazon's figure, $10,000 a second Amazon is making at the moment. It's not making much profit anymore because it's had to employ 175,000 more workers and provide safety conditions and raise their wages in order to meet the demand that it's got. That tells you if it didn't raise you've never raised the wages before, it didn't provide health conditions before, so basically it was exploiting hundreds of thousands of workers to make huge, huge profits. Companies like Amazon and broadband companies and social media companies and all the transport companies should be publicly owned. They're part of the plan so that we can organise society in a way which benefits everybody and not just the profits of the billionaires. So that is the lessons I've learned from this so far. I hope to hear what other people think. Thank you, Lucy.